Hi, I'm Michael Morrissey, the Norfolk County District Attorney, and tonight I have the opportunity to speak with some people who I think can help enlighten us as to the problems that I see every day in the District Attorney's office. During the campaign, I had a chance to speak with a lot of great families who were struggling with addiction issues and substance abuse issues, including some that had even suffered death of a family member. And my wife and I grew up with a good friend of ours whose 22-year-old daughter was a victim of an overdose and had left a 2-year-old, and that leaves a pretty lasting impression when you take a look at the devastation that it's causing on families and even now with a young child. And it's something that I knew that was out there and always thought that it was an issue that we'd have to face and be a priority of the District Attorney's Office. But it was also brought home more recently that when I took office, I also found out that when there is a sudden or unattended death, the District Attorney's Office must be notified and investigate. And even after the first week in office, I saw that there was a good number of people who were victims of overdoses, of suicides, or whose deaths, well, it may have been unattended, could have been traced back to drug or substance abuse issues. And it's really something that has stuck with me during this first 45 days of my administration. And I know that we can handle prosecution, but really that's only one small part of the problem. The bigger issue is try to educate people and to let people know. As I talk to families, my heart goes out to people that are working with young kids, especially trying to give them the right advice. And tonight I have the opportunity to speak with some people who I think that see it in the front line, whether it's in the school system, in my own school that I grew up with, in North Quincy High School. I have Kristen Houlihan, the school nurse from North Quincy High School, and Lynn Frana, who's active with Mayor Kay in the Weymouth fight. And this is not an issue that even though I live here in the city of Quincy, it's an issue that faces every community, because the calls I was getting the first weekend were the Renthams and the Wellesleys and the Needhams. They were not just on the South Shore. It is all over Norfolk County. Dr. John Kelly is the first person I'm going to ask to have a couple of words to say about this, because I think that they can help us decide from both the big picture down to actually what they see going on the streets. And Dr. John Kelly is an associate professor in psychiatry at Harvard Medical School, and he's the director of addiction at the recovery services at Mass General Hospital. So Dr. Kelly, if you can maybe talk a little bit about what you see on a day-to-day and what you think that parents and others should know about how we got here from even when I was much younger.
All right. Thank you, Michael. It's a pleasure to be here. And substance misuse, of course, overall is our nation's #1 public health problem. What we've seen in the last 20 years is a huge increase in so-called misuse of psychotherapeutic drugs. These are prescribed medications like opiates, stimulants, sedatives, which have come along and are very well manufactured to do their job extremely well. And they've been prescribed more and more during the last 20 years. And so we've had this excess availability and accessibility of these kinds of drugs, and which has meant that young people have gotten exposed to them a lot more than they would have done prior to 20 years ago. We've seen this huge increase in use. One of the issues with these particular drugs, specifically opiates, opiate-derived drugs like OxyContin, which is people I'm sure have heard of, is that they're very seductive. The effects of analgesic effects, the pain-killing effects, also produce very desirable cognitive and emotional effects that people like, and so they're likely to repeat it. And young people, of course, are notorious for experimenting with drugs, and if they're handing them around with the perception that they're safe because they were prescribed at one point, even though they're being diverted, they're getting exposed to them. Young people get exposed to them, and because they are seductive and produce this pleasant effects, people repeat them, and they're not aware that they could potentially get addicted to them.
If I had had a family member, if I was from a family who had some pre-existing tendencies to substance abuse issues, alcoholic or substance abuse issues on parent or grandparent level. I mean, would that have an effect? Genetics play a role in the susceptibility of some people to drug use?
It does. There's a heritable risk of about a fourfold increased risk. So if you're the offspring of a parent or a first-degree relative, you have a fourfold increased risk of developing a substance use disorder. If you have a parent and a grandparent, then your risk is probably more like 6 to 10-fold. So if there's another generation above that, which demonstrates, for example, alcohol dependence, then all other things being equal, you have about a 4 to 10-fold increased risk of developing an addiction problem. If you are exposed to it, of course. You need to be exposed to substances in order to, and at regular levels, to be able to develop an addiction. So it's not just genetics, but genetics do play a role. What we've seen, of course, recently is greater access. So the more access you have to a drug, the more likely you are, for those people who are vulnerable, are likely to get exposed to it and become addicted to it. And that's what we've seen.
Has anybody ever done any studies on whether the overprescribing of medication by doctors, as far as, is that going on, and how do you stop that? Or is it a case of we're not properly maintaining and handling and securing drugs that are given to us as individuals, and they fall in the hands of the wrong person?
Well, I think both of those things. I mean, I don't think anybody really saw this coming. The way that often these things happen is that people don't see them occurring until it's too late. And now we've got so many of these drugs out there. I think in one of the slides, I talk about the where people get these drugs from, and most of them are these prescription drugs. Most of them are getting them from their medicine cabinet, from a medicine cabinet home. About 60% get them from their family or friends, and the other 15%, another 15%, buy them from friends or relatives, or steal them from home. So 75% of access comes from basically friends and relatives, not bought on the street.
So people aren't just manufacturing these drugs themselves; they're
Right.
actually buying.
They're exactly, yeah.
And it's not something that in the old days, like marijuana, you could grow. People aren't just making pills. That
Right.
they're
No.
getting them. The manufacturer obviously has them out in society, and
Right.
so there's an intermediary where people are getting access to it,
Right, for
because
sure.
probably our own shortcomings of lapse handling of what we don't consider to be dangerous turn out to be a danger to members of society.
Right.
I'm shocked at how expensive some of the drugs are. You mentioned OxyContin. They tell me that I think Lynn suggested about $1 a milligram. So if a person was taking 4 to 5 30 milligram oxys a day, that could be $100, $200 a day pretty easily.
Right. And I think that's why we've seen this progression from initial misuse of psychotherapeutic opiates to heroin, because it's actually cheaper to buy heroin than it is eventually to buy these large doses of opiate prescription drugs on the street.
They tell me that heroin actually is probably one of the cheapest drugs on the street these days.
Right. And those prices do go up and down according to availability, but yes.
So after you exhaust what, I guess I see in the DA's office, some of the aftermath is that after you run out of your own money, and or I suppose breaking the bank of the relatives and other money you can put your hand on, then you start in with the larcenies, and
for sure.
We find a lot of people now involved in other crimes, even as far as bank robbery and armed assaults on the increase.
Yeah. Because these drugs, they really hijack the reward pathway in the brain, and they lead people to do things against their better judgment. And so they ended up, even though they had, most people, you ask them, did you plan on getting addicted? And doing, no way. I never planned on going down this path at all. But this is what happens: is that a drug like an opiate drug, in the right brain, can just hijack that brain, and it will make you do things that you never thought you would be doing, including stealing, muggings, whatever it is, to get your fix.